Welcome to the deep dive. Ever feel like your cat is locked in this never-ending battle with an invisible enemy, constantly scratching, licking, leaving the little tumbleweeds of fur everywhere?
Yeah.
Today we're diving into the frustrating world of atopic dermatitis in cats, that persistent, environmentally triggered itch that can drive both you and your feline friend a little crazy.
It's such a common worry for cat owners. It really is.
Yeah,
And honestly, watching your cat be so uncomfortable is just tough.
it is.
And while we can't just wave a magic wand and make it disappear completely, the good news is, with the right approach, it's definitely something we can get under control, manage effectively.
Absolutely. And that's exactly what we're here to do. We've taken a deep dive into the science to bring you the most important, easy to understand information about why some kitties get so incredibly itchy.
Yeah, break it down a bit.
Our goal is to give you practical insights and help you navigate this, well, sometimes puzzling condition.
Okay, so let's get right to it. What exactly is going on when a cat has feline atopic dermatitis? Think of it like this. Your cat's immune system, it's designed to protect them, right?
Okay.
But with atopic dermatitis, it gets a little overzealous
Okay.
about everyday things in their environment.
Mm-hmm.
Things that are normally harmless, like, dust or pollen, we call these allergens. They suddenly trigger this big, itchy reaction. It's like their body is hitting the panic button over something totally normal.
So who are these usual suspects causing all this drama? What are the common environmental triggers that can set off this itchy frenzy?
We're talking about the usual household suspects, really.
Yeah.
Pollen from trees, grasses, weeds that, hitch a ride indoors.
Right.
There's microscopic mold spores that can be anywhere. There's a bit of dampness. The dust mites living in our sofas and carpets.
Ugh, dust mites.
Exactly. And even those tiny flakes of skin dander from other animals in the house. Or even from us, actually. It's a surprisingly long list of potential irritants.
It sounds like they're living in an invisible obstacle course of itch. Now, we've heard this called a hypersensitivity. Is there a reason why some cats develop this and others don't? Is it just bad luck?
Well, there's definitely a genetic component at play. This hypersensitivity, this tendency to overreact, it can be passed down.
Oh, okay.
We do see that certain purebred cats, for example, seem to be more predisposed to developing atopic dermatitis than your average mixed breed cat.
Oh.
So yeah, sometimes it's just in their feline family history.
Interesting. So some kitties are just wired to be a bit more sensitive. Is there a typical age when this itchy saga tends to begin?
We often see the signs starting between the ages of, say, 1 and 4 years old.
Okay.
That time frame can be a helpful clue for your veterinarian as they're trying to figure out what might be going on. Of course, just to keep us on our toes, it can sometimes show up outside that age range too.
Right.
So age is just one piece of the puzzle. Yeah.
Right. It's not an exact science. Now, when a cat starts scratching like there's no tomorrow, the first thing many of us think is fleas, right?
Oh, absolutely. Fleas first.
Or maybe they ate something that didn't agree with them. How does atopic dermatitis fit into figuring out what's causing the itch?
That's a really important point. Diagnosing atopic dermatitis in cats isn't like taking a simple test. It's actually what we call a diagnosis of exclusion.
Diagnosis of exclusion, okay.
Think of it like a detective ruling out suspects one by one. The very first thing any vet will do with an itchy cat is try to rule out those more common and obvious culprits, like fleas or a food allergy.
Right.
We need to be sure it's not something simpler before we start pointing the finger at environmental allergies.
Okay, so we've got these tiny environmental invaders causing an over-the-top reaction, but how do our cats actually show us they're itchy? Because sometimes it's not just them dramatically scratching their ear, right? They can be pretty subtle about it.
You're absolutely right. Cats can be masters of disguise when it comes to their itching. Owners might not always immediately recognize certain behaviors as signs of what we call pruritus, that lovely medical term for itchiness.
Pruritus. Got it. Okay, so beyond the classic frantic scratching, what are some of the sneakier signs that our cats might be trying to tell us they're itchy?
Well, think about excessive licking.
Hmm.
Maybe they're constantly grooming one particular spot,
Mm-hmm.
or chewing at their paws or fur.
Yeah.
Head shaking or frequent paw licking can also be clues. Some cats even get so intensely itchy that they start biting their nails or pulling out their own hair.
Oh, wow.
Sometimes leaving bald patches that seem to appear almost overnight.
Yeah.
And here's a really interesting one. Because cats are often secretive lickers, constantly grooming to soothe the itch.
Right.
You might actually see an increase in hairballs.
Really? Hairballs?
Yeah. So if your cat is suddenly producing more hairballs than usual, That could potentially be a sign of underlying itchiness that you're not directly witnessing.
Wow, hairballs as a secret code for I'm itchy. I definitely wouldn't have thought of that. So all this scratching and licking can lead to hair loss, but what about changes to their skin that we can see? Are those always obvious when it's atopic dermatitis?
Not always, no. And that's another way. Feline atopic dermatitis can be a bit different from what we often see in dogs with allergies.
Okay.
Especially in the early stages, you might not see a lot of obvious redness or inflammation on the skin. The hair loss is often self-inflicted from the licking and chewing. So the skin underneath might actually look relatively normal, at least at first glance.
That's sneaky. So if we're not seeing a lot of red, inflamed skin, what kind of skin changes might make us think it could be something other than early atopic dermatitis?
Well, if you start noticing a lot of crusting or scaling on your cat's skin, that's generally less common in the initial stages of feline atopic dermatitis.
Okay.
That might suggest other things like those pesky external parasites we talked about earlier, fleas, mites,
Right.
or even some less common conditions like fungal infections, maybe certain autoimmune skin diseases, things like that.
Okay, so we've got a cat showing these subtle signs of being itchy. How does the vet actually go about figuring out if it's atopic dermatitis? It sounds like it's more than just a quick look.
You're spot on. It's definitely not a quick diagnosis. Figuring out if it's feline atopic dermatitis is really like putting on your detective hat and systematically ruling out all the other possibilities.
So where does this detective work begin? What's the first thing the vet will likely do?
It almost always starts with a really detailed history. Your vet will ask you a whole bunch of questions.
Like what?
Like, when did you first notice the itching? How often does it happen? What seems to make it better or worse? And all about your cat's environment. Are they indoors only? Do they go outside and explore? That kind of thing.
That makes sense, trying to build a timeline and understand potential exposures. What else will the vet want to know in this investigative questioning?
They'll definitely want to know if there are any other pets in your household and if they're experiencing similar issues.
Okay, contagion.
Exactly. This can help rule out contagious things like mites or ringworm. And it's super helpful for the vet to know your cat's medical history. What treatments have you tried before? Did anything provide relief, even temporarily? And just as importantly, what didn't work at all? For example, as we mentioned, early atopy often shows some initial improvement with steroid medication.
Yeah, the steroids.
So if a cat doesn't respond to those, it might make the vet think about other possibilities.
So even what doesn't work can be a valuable clue. Now, I've heard about how certain skin conditions tend to show up in specific areas on a pet. Is that something vets look at with itchy cats?
We do pay attention to patterns, yes.
Okay.
For instance, we often see itching around the head and neck, or a set of skin reactions we call the eosinophilic granuloma complex.
Eosinophilic granuloma complex, okay.
Or sometimes a symmetrical hair loss pattern, or even tiny crusty bumps known as miliary dermatitis.
Miliary dermatitis.
However, the tricky thing with cats is that these patterns aren't exclusive to atopic dermatitis. A cat scratching its head a lot could have allergies, sure, but it could also have ear mites or even a food sensitivity. So these patterns can be helpful hints, but they're not definitive on their own.
Got it. So history and patterns give us some clues, but what about the actual physical examination? What will the vet be looking for and doing?
A thorough physical and dermatological exam is absolutely essential. One thing vets often do is a trichogram. Sounds fancy.
Not a cogogram.
But it's just looking at some of your cat's hairs under a microscope.
Okay.
This can tell us if the hair shafts are broken or frayed, which is a sign of them licking or chewing at their fur due to itch, even if you haven't actually seen them doing it.
That's like microscopic detective work. What about looking at the skin itself more closely?
Definitely. Your vet will likely take samples from your cat's skin. We call this skin cytology.
Cytology, okay.
They'll collect cells from the surface and look at them under a microscope. This helps us see if there are increased numbers of certain inflammatory cells, like eosinophils, which are often involved in allergic reactions.
Right, those eosinophils again?
Exactly. We can also look for any signs of secondary bacterial infections that can sometimes pop up when a cat's itchy and scratching a lot.
Makes sense.
Interestingly, yeast infections, they seem to be less common with feline allergic dermatitis compared to what we often see in itchy dogs.
Oh, that's different.
It is. And one more thing to keep in mind. If your cat has recurring ear infections in both ears, that can sometimes be a subtle sign of underlying allergies.
The ears too. Okay, so we've ruled out the obvious culprits, taken a detailed history, done a thorough exam, maybe even peered at skin cells under a microscope. If atopic dermatitis is still a strong possibility, What's the next step? Is that when allergy testing comes into play?
Exactly. Once
Yeah.
we've done our due diligence and eliminated those other more common causes of itching, then we can start thinking about allergy testing
Right.
to try and identify the specific environmental allergens that might be triggering your cat's over-the-top immune response.
And what are the main ways they go about allergy testing in cats? I know there are skin tests and blood tests, but how do they work for our feline
The
friends?
two main types are intradermal skin testing and serological blood tests.
Okay.
Intradermal testing is often considered the most, let's say, direct way to test for environmental allergies. It involves injecting tiny amounts of various purified allergens just under the surface of your cat's skin,
Hmm.
and then carefully observing if there's a localized reaction, like a little red bump or swelling,
Right.
at the injection site. That would suggest a sensitivity to that specific allergen.
Okay.
Interpreting these skin reactions in cats can sometimes be a bit more challenging than in dogs, and vets sometimes use a special dye to help highlight the positive reactions, make them easier to see.
Okay, so tiny allergen injections under the skin sounds a little bit like a mini science experiment happening right on their belly. What about the blood tests? How do those work?
Serological or blood-based allergy tests look for specific antibodies in your cat's blood, called IgE antibodies.
IgE, right.
These IgE antibodies are often produced in higher amounts when there's an allergic reaction to something.
Hmm?
These blood tests are generally easier for your regular vet to perform, just a blood draw.
Easier.
No. However, it's important to understand that the reliability of these blood tests in cats has been, well, a topic of some discussion in the veterinary world.
Oh.
There can be variability in results between different labs, and sometimes the results don't perfectly match up with what we see with intradermal skin testing, or even with a cat's actual symptoms.
So it's not always a clear-cut answer no matter which type of test you do.
That's right. And this is a crucial takeaway. Whether you opt for skin testing or a blood test, just getting a positive result for a particular allergen doesn't automatically mean that's definitely the cause of your cat's itching.
Right. Correlation isn't causation.
Exactly. We always have to take those test results and put them together with the whole picture, your cat's history, the physical exam findings, and whether their itching seems to be seasonal or year-round.
Okay.
Interestingly, some veterinarians find that the blood tests might be more helpful in identifying allergies to things that are present year-round, like dust mites or mold in cats.
Ah, okay, for the non-seasonal stuff. So it's about piecing together all the clues, the history, the exam, and the allergy test results. Once we've hopefully identified some of these triggering allergens, what can we actually do to help our itchy kitties? How do we manage this atopic dermatitis?
Management is really the key word with feline atopic dermatitis. It's usually a long-term commitment and often involves a multi-pronged approach,
Multi-pronged.
meaning we use several different strategies working together to get the best outcome. Not usually just one thing.
Okay, so what are the main tools in our anti-itch toolbox?
First and foremost is allergen avoidance. If we've been able to pinpoint specific allergens through testing, the ideal scenario is to try and minimize your cat's exposure to them as much as possible.
Ray.
This might mean more frequent and thorough cleaning of your home, paying extra attention to areas where your cat spends a lot of time.
More vacuuming.
Definitely more vacuuming. If pollen is a trigger, keeping them indoors during peak pollen seasons could be beneficial. And maybe avoiding certain household sprays or air fresheners might also make a difference.
Makes sense. If you know what's bothering them, try to keep them away from it. What's the next line of defense? I've heard about allergy shots for pets, just like people get.
Yes, that's allergen-specific immunotherapy, often called ASITE.
A-site.
It's essentially like getting allergy shots, but tailored to your cat's specific allergies identified through testing. We create a special formula containing small amounts of the allergens your cat reacts to,
Okay.
and gradually administer increasing doses. The goal is to help their immune system become less reactive, sort of desensitize them to these allergens over time.
And how is that given?
This can be done through regular injections, usually given weekly, or even as liquid drops that you give under their tongue.
Oh, under the tongue.
Yeah, sublingual immunotherapy. And many cat owners are actually surprised to find that their cats tolerate the weekly injections quite well.
That's good to hear. I always imagined giving a cat regular injections would be a wrestling match.
Sometimes it is, but often they get used to it.
So allergen avoidance and these allergy shots, ASET, are aimed at the underlying cause. But what about when the itch is really intense right now? What can we do to give our cats some immediate relief?
Right, that's where symptomatic treatments come in. These are designed to directly target the itching and make your cat more comfortable, like right away.
Okay.
We have several options available. Antihistamines are often a first-line choice. They're generally quite safe, relatively inexpensive,
Mm-hmm.
and can be helpful in reducing mild to moderate itching, especially when used in combination with other treatments. Common antihistamines used in cats include chlorpheniramine and cetirizine.
Cetirizine, like Zyrtec for people.
Similar, yes, but always use the vet-recommended dose for cats, of course. It's worth noting that some of the older antihistamines can cause drowsiness, a bit of sedation.
Okay, antihistamines are a familiar concept. What other options do we have for tackling that immediate itch?
Well, while our sources didn't go into a lot of detail today, topical therapies like certain medicated creams or sprays can be helpful for localized areas of itchy skin.
Right, for specific spots.
Exactly. Then we have glucocorticoids, also known as steroids.
The big guns.
Kinda, yeah. They're very effective at quickly reducing inflammation and providing rapid relief from itching. They come in various forms, pills, liquids, injections, which can be convenient.
But there's always a but with steroids, isn't there?
There often is, especially with long-term use. It's really important to remember that prolonged steroid use can have potential side effects.
Like what?
Things like increased thirst and urination, weight gain, thinning of the skin, a higher risk of infections, even changes in blood sugar or liver issues.
Wow, okay.
So the aim is always, always to use the lowest effective dose for the shortest amount of time possible to keep your cat comfortable.
Steroids can be a lifesaver for quick relief, but definitely have potential downsides with prolonged use. Are there other medications that can help manage the itch long-term without quite the same level of risk?
Yes, absolutely. Cyclosporine is a medication that helps to suppress the immune system,
Cyclosporine.
and it's often considered a safer option for long-term management of atopic dermatitis in many cats compared to steroids. It tends to have fewer of those metabolic side effects, like changes in blood sugar.
That's good.
However, it can take several weeks to really start working effectively.
Not a quick fix then.
Not usually, no.
Yeah.
And it does have a somewhat bitter taste that some cats find unpleasant, which can make giving it a challenge.
Yeah, picky cats.
Tell me about it. The liquid form also has specific storage requirements once opened, and regular checkups with your vet are important while your cat is on cyclosporine to monitor for any potential side effects.
Okay, cyclosporine, another important tool for long-term itch control. What about some of the newer medications we hear about for allergies in dogs? Are those being used in cats as well?
You might be thinking of oclacitinib.
Yes, that's the one. A Pocal, right.
Right, that's the brand name for dogs. Oclacitinib is a newer medication that specifically targets the pathways involved in itching. It's licensed for use in dogs and has been very helpful for many of them.
And cats.
It is sometimes used off-label in cats,
Off-label?
meaning veterinarians can prescribe it if they think it's appropriate, even though it's not specifically approved for feline use. However, the experience so far suggests that the response rates in cats might not be as high as what we see in dogs.
Okay.
We're still gathering more data about its long-term safety in our feline patients. So it's an option, but maybe not the first go-to yet for every cat.
Interesting. So it might be an option in some cases, but maybe needs more research in cats.
Yeah.
What about some of the more supportive therapies? I've heard about things like essential fatty acid supplements, omega-3s.
Yes, essential fatty acid supplements like omega-3 and omega-6 can be a beneficial addition to the overall management plan. They can help to strengthen the skin's natural barrier, which can become damaged in allergic cats. And they can also have mild anti-inflammatory effects over time.
Overtime being the key phrase.
Definitely. It's important to have realistic expectations. You usually need to give them for several weeks, if not months, to see a noticeable improvement. They're more of a supportive measure than a quick fix for intense itching.
So more of a slow and steady kind of help. Anything else we should know about helping our cats cope with the discomfort of itchy skin?
Well, sometimes gabapentin, which is often used to help with pain and anxiety in cats, can also be helpful in managing the discomfort and stress that can come with chronic itching. Can kind of take the edge off.
That makes sense if they're stressed from the itching. It sounds like managing feline atopic dermatitis is a bit like putting together a puzzle, using different pieces, different treatments and approaches to find the best fit for each individual cat.
Absolutely. That's a great way to put it. And this is where open and honest communication between you, the cat owner, and your veterinarian is absolutely crucial.
Communication is key.
It really is. Finding a management plan that not only effectively controls the itch, but is also something that you can realistically maintain long term. that's essential for your cat's well-being and, frankly, for your relationship with them, too.
That makes total sense. A treatment plan that causes more stress than the itch itself isn't going to be sustainable. What are some of the things owners should really talk openly with their vet about to make this work?
Well, one big one is just the practicalities of giving medication to your cat.
Ah, yes, the eternal struggle.
Right. As anyone who's tried to pill a cat knows, it can be quite an adventure. So discussing the different options, pills, liquids, maybe flavored chews if they're available, or even transdermal gels you put on the ear.
Oh, yeah.
Yeah. Figuring out what will be the least stressful and most effective way for you to administer medication is vital for long-term success. Compliance is huge.
Definitely.
And it's also really important to schedule regular follow-up appointments with your vet. Exactly. So they can monitor how your cat is doing and adjust the treatment plan as needed. What works initially might need to be tweaked over time as things change.
So it's an ongoing partnership between owner and vet. We've covered a lot of ground today, from understanding the basics of atopic dermatitis to recognizing the often subtle signs, the detective work of diagnosis, allergy testing, and a whole range of management strategies. What are the key things you'd want our listeners to take away from this discussion?
I think the most important thing to remember is that feline atopic dermatitis is a chronic condition. It requires ongoing management.
Chronic. Yeah.
While we can't cure it, we can definitely make a huge difference in your cat's comfort and quality of life. Effective management often involves a combination of approaches.
The multi-pronged thing.
Right. Trying to reduce exposure to known allergens, considering allergen-specific immunotherapy, using medications to control those frustrating symptoms of itch. And most importantly, working closely with your veterinarian is absolutely essential for getting an accurate diagnosis and developing a personalized treatment plan that will give your feline friend the best possible outcome.
Excellent summary. It's all about being observant, partnering with your vet like a furry Sherlock Holmes team, and understanding that managing this is a marathon, not a sprint.
Precisely. Couldn't have said it better.
And that brings us to our final thought for you today. Considering how many different things in their environment can potentially trigger this in our feline companions, what seemingly minor changes in your cat's behavior might be the very earliest signals that their skin is starting to bother them, even before the full-blown scratching starts. It's definitely something to keep an eye out for.
It is indeed. And one final but very important reminder for everyone listening. The information we've discussed today is intended for educational purposes only.
Absolutely.
It should never, ever be considered a substitute for professional veterinary advice. Always, always consult with a certified veterinarian for any health concerns that your beloved pet may have. They are the best resource for diagnosing and treating your individual cat.
Couldn't agree more. Thanks for diving deep with us today.
My pleasure.
Until our next exploration on the deep dive.